For the NCLEX, you must be able to instantly differentiate between hypothyroidism and hyperthyroidism, as they are polar opposites. Let's start with hypothyroidism, where everything is low and slow. The thyroid isn't producing enough T3 and T4 hormones. Think of a patient who complains of constant fatigue, unexplained weight gain despite a poor appetite, and being cold when others are comfortable. They might also report constipation, brittle hair, and dry skin. The most severe form is myxedema coma, a critical, low-energy state. The most common cause tested is Hashimoto's thyroiditis, an autoimmune disorder. For lab values, the exam will test the inverse relationship. In primary hypothyroidism, the pituitary gland is trying to stimulate a failing thyroid, so it screams by releasing more thyroid-stimulating hormone, or TSH. Your TSH will be high, while your T3 and T4 levels will be low. Now let's flip to hyperthyroidism, where everything is high and hot. The thyroid is in overdrive, flooding the body with T3 and T4. Your exam question will describe a client who is anxious, irritable, and has heart palpitations. They report significant weight loss despite eating more, and they can't tolerate heat. You'll also see diarrhea and insomnia. The classic autoimmune cause is Graves' disease, and the hallmark sign you must know is exophthalmos, which is the bulging of the eyes. Labs will show the opposite pattern of hypothyroidism. Since the thyroid is overproducing on its own, the pituitary gland stops trying to stimulate it. TSH will be low, while T3 and T4 will be very high. A simple way to keep this straight for the exam is to think of the thyroid as the body's engine. In hyperthyroidism, the engine is revving high and running hot. In hypothyroidism, the engine is running low and slow. The most critical priority question you will see is about thyroid storm, a life-threatening complication of hyperthyroidism. The scenario will feature a patient with a history of Graves' disease, perhaps post-surgery or with an infection, who suddenly develops a high fever, extreme tachycardia, hypertension, and delirium. This is an emergency requiring immediate intervention to lower the heart rate and temperature. Medication questions are guaranteed. For hypothyroidism, the treatment is levothyroxine. The most common exam trap revolves around patient teaching. You must instruct the patient to take this medication first thing in the morning, on an empty stomach, at least 30 to 60 minutes before any other food, drink, or medication. It is a lifelong therapy. For hyperthyroidism, common medications are methimazole and propylthiouracil, or PTU. The number one life-threatening side effect is agranulocytosis, a severe drop in white blood cells. If your patient on methimazole calls reporting a fever and sore throat, this is your priority call to make. They need to come in immediately for a blood count. Another treatment is radioactive iodine, which destroys the thyroid gland. Exam questions here focus on safety precautions. The patient must use a private toilet and flush twice. Avoid close contact with pregnant women and children for about a week, and use separate utensils and laundry. These safety measures are frequently tested in select all that apply questions.